Hello and welcome to this video series about lip and tongue ties. This is video number 2, and this time we are talking about assessing ties. Now, here's the simple thing with ties is that anybody can really assess and evaluate for them. Technically, only doctors, neonatologists, pediatricians, nurse practitioners can technically diagnose a tie. However, the big controversy with that is that they're not actually watching you breastfeed. They're not watching you latch, how it looks from the outside, what your nipple's looking like after your baby latches. So my main thing for you is you want to trust your gut instinct. You want to take all of this knowledge, take this education, and really trust your own maternal instincts. If you feel like your baby has a lip and tongue tie and you want to reach out and get it fixed, insurance, you don't need referrals mostly anymore. You can go see a pediatric dentist, ENT, there's one more person, plastics. You can kind of go see anybody to get these released, and that is your decision as a parent. So that's the number one thing that I want to talk about. So right away for assessing ties, we're going to jump right in. Once your baby is born, this is the first thing that I want you to do. The first thing that I want you to do is just latch your baby. Okay? In that golden hour, okay? You want that first hour, and you want to just try and latch your baby on your own. Okay, stay skin to skin, latch your baby, see how everything goes. If you're feeling a lot of pain, any issues with a super shallow latch, you can't get baby coordinated at the breast and a couple of other things, then we'll go on to that. But spend a few minutes, snuggle, try and hand express a couple of drops of colostrum on your nipple and try and get baby latched. And do the flipple technique, really try and get that baby nice and deep, lips flanged out, watch that latch video again, and really try and do everything that you can possible and try and see if it's actually a lip or tongue tie, and just enjoy your baby that first hour. If ultimately they can't latch, then you can start doing an assessment. But for the majority of time, just try and latch them and enjoy them. If you feel like it's like toe curling pain and it's not going away within 30 seconds to a minute, then just pop off and just do a quick assessment. Okay, you want to make sure your nipple comes out correctly, make sure there's not severe pain, make sure the latch is nice and deep. Okay, so the next thing that you're going to do is evaluate the tongue and lip. Evaluate for ties. Okay, so my friend let me actually take a video of her son. He doesn't have a lip tie, but he does have a little bit of a posterior tongue tie still. He did get it clipped, but it rehealed back together. And we'll kind of talk about that a little bit as well. So for the lip is super simple. Let me grab my baby doll real quick. So the first thing that you want to do is you want to lie your baby down flat, and you're at the head of your baby. Okay, I'm gonna like this stance. And then what you're gonna do is you're gonna take your 2 fingers and you're gonna flip that lip up. I'm getting a Charlie horse in my foot. Okay, so you're gonna you're gonna flip that lip up and make sure it can flip all the way up to the nose and it's super stretchy. Okay, so that one is super easy to do, the lip tie. Really, there's not much to look for. If you notice that little piece of frenulum going all the way around the gum, that's why babies have a gap in their teeth, is because they have a stage 4 lip tie. So you want to assess for that. The next one is a little trickier, so definitely wash your hands first before you do any of this. If you're at the hospital, just grab some of the gloves off the wall. So you can do that. And then the next one is a little trickier, it's the tongue. So the first thing I want you to look at is try and make your baby cry, or when you notice when they cry, when they lift up their tongue, usually when they cry, their tongue lifts up to the roof of the mouth, and you might see that tight frenulum right there when they cry. Usually those anteriors are really obvious. So those are the easiest ones. So they're gonna cry and you're gonna see that little piece underneath and their tongue's really not going anywhere. And you're gonna be like, yep, anterior tongue tie right there. Super easy. Okay, now the next thing that you wanna do is you wanna do a sweep underneath the tongue. So this is the second easiest thing. So you're literally just gonna put your finger underneath their tongue and you're gonna sweep from side to side. Okay, like this underneath their tongue. It should be pretty smooth. You shouldn't feel a lot of resistance like pretty far out in the mouth. You know, if it's way back there, you know, that's that can be tricky. But if you feel like you have to move your finger to go on either side and you can't move smoothly, then that is hitting a lot of resistance, and that could be a posterior tongue tie that's like embedded in the mucosa of the lower part of the mouth. Now the last one that's super tricky is you're going to take both fingers. I have to put the baby down, right? So if the baby's in front of me, you're going to take those two fingers again, and you're going to reach deep into both pockets of the mouth on either side, and you are literally going to pull back and look at that whole tongue. Now I will show you the video on my friend's son. He didn't like it. He's also a little bigger. He's like, I think he was 3 months old at the time. So it can be a little tricky with newborns. They're a little easier because they're smaller in the crib, but have somebody else at the foot of the bed or in the crib, kind of holding them just gently, like their arms and their core, just holding them gently so you can really pull in and back and really have a good visual of that whole tongue. Okay, now the other thing with tongue ties is clicking. With clicking, you might not always have an issue with a tongue tie now or a lip tie. My daughter had like a stage 3, almost 4 lip tie, and she had a lot of clicking. However, when we went to a lactation consultant, they weighed her before and after, and even with the clicking, she was still able to transfer and take out 4 ounces of milk, which is phenomenal. So even with the clicking, it was just a noise thing. It didn't necessarily mean that it was a problem, that clicking was an issue in that lip tie. She had a couple of blisters, but she was able to grow, and like literally in 2 weeks it was gone. So there was no issues with that. So this is something that you can just do right after birth or anytime. This is part of my nursing assessment on babies. Even though technically I can assess, I can't diagnose, I can tell the parents and give them information about what they want to watch out for, what they want to, just any ideas for the future if they want to get it fixed. And, and I go over my whole assessment with them. So then at least they have that knowledge in their mind. And you as the parent have the right, you get to choose what you want to do. If you want to leave it alone and just do the wait and see game, go right ahead. That's completely fine. However, if you have a really bad tie and you want to have a successful breastfeeding journey, there's a couple things that you can do that's going to be super helpful on your journey. So that's about assessing ties. Really, those are the simple things that you want to do right after birth. You can just wash your hands, check the lip real quick. Usually it's like a 3-minute assessment that you can do on your baby. And then that will kind of give you the peace of mind knowing if they have a really bad tongue tie or lip tie or not. And then you can move to that other breastfeeding plan, which I'll attach below as well, for the jaundice or lip and tongue tie feeding plans, because this is something that we want to do right from the beginning. I definitely recommend, even if you have a really great latch right after birth, still evaluate a lip and tongue tie, just so you know, maybe if it's a small one, it's not affecting it right now, it could possibly in the future, and at least you'll know kind of where you started at, like your baseline foundation of your baby. Okay, so that's assessing ties. Again, reach out in our Facebook group, and I can do another live on it and stuff too, and I'm gonna tag that other video below so you can really look for the ties and know exactly what you're doing. Okay, all right.